Sexual anxiety is intense fear or extreme worry towards sexual activity. And it's not a clinical term, it's not a diagnosis by itself, but we have different labels that can explain sexual anxiety or can be associated with sexual anxiety according to the manuals that we have right now for diagnosing mental illnesses like the DSM. So we already know that men and women have different sex organs, and so the way that they're going to experience sexual anxiety is going to be very different. So if we start, for example, with women, we can look at what we call penetration disorder right now that we have as a diagnosis in our manual, which can also be called genitopelvic pain. And here the woman is going to experience a lot of pain during sexual penetration. And when penetration happens, they're likely to experience tightening of the vaginal muscles or the pelvic floor muscles. There would be a lot of tension there, such that it would make sexual penetration impossible, but also very painful for the woman. And so they would have these fears of even engaging in physical intimacy because they're afraid that it might lead into, so the presentation may be different. For some, they would be able to communicate this to their partner, and if the partner is very facilitative, very understanding, then they're not afraid of engaging in physical intimacy up to a level where they do not get into the penetration or the penetrative sex. So there have been other terms that have been used to explain the same disorder. For example, gynecologists may use the term as dyspareunia, pain during sex, or vaginismus, where a patient experiences tensing of the muscles in the pelvic floor during intercourse. So the most important thing is to understand what may have put the patient into this state. So one, is this condition lifelong, meaning from the beginning of sexual experience this woman has been having sexual anxiety, which is perhaps the penetration disorder? Or is it acquired, meaning initially the woman got into sexual experiences and was okay, but then now that perhaps they've changed partners, they're experiencing these difficulties. So factors such as perhaps past history of sexual abuse or sexual assault, emotional abuse, attitude towards sex that may be individual or cultural. There are cultures and religious factors where sex is presented as something bad, and so it's only good after you get married. But between the transition of sex is bad when you're single and sex is good when you get married, perhaps there's no adequate preparation for that sexual experience. And so you want to experience all these factors. Also, you want to look at the other partner and how they are towards sex. Sometimes you might find that the other partner wants more and the female partner wants less. And so that discrepancy can also be a factor. Also, you look at the relationship, maybe the way they discuss intimacy, the way they relate when it comes to sexual intimacy is very different. They have different expectations towards perhaps stimulation, or they have different needs. And so all these, exploring what has contributed to put this individual who's experiencing sexual anxiety into this state is very important. They might be experiencing depression, a depressive episode, or anxiety, meaning there may be other anxiety disorders that are going on, and sex is just part of that. So here we might come up with the term of generalized anxiety disorder, meaning they have multiple points that make them anxious, and sex is just one of those points. So understanding what has put the patient here, the causes of this sexual anxiety, is very, very important in determining what treatment you're going to offer. For men, the typical presentation is usually erectile dysfunction, when a man is unable to reach full rigidity of their penis to be able to participate fully in the activity of sex. And also you do the same thing. You'd want to explore what has put this man into this sexual anxiety. The contributing factors, the causes of sexual anxiety, are what is going to help you determine the correct intervention for the individual, and also enable you to get the diagnosis right.